All right, good morning, everyone. Thanks for joining. For those of you that don't know me, my name is Suzanne Morley. I am a Health Promotion Program Coordinator with the Wisconsin Institute for Healthy Aging, or WIHA. And I'm glad to introduce you to this webinar to celebrate the release of our new toolkit addressing older adult falls through coordinated collaboration between community-based organizations, or CBOs, and emergency medical services, or EMS. If you're not familiar with WIHA, we are a nonprofit administrator of evidence-based healthy aging programs and practices throughout the state. And we also convene the Falls Free Wisconsin Coalition, which is a statewide falls prevention collaborative made up of local falls and injury prevention coalitions, community-based organizations like aging and disability resource centers, health and managed care providers, public safety, and others who are part of a movement to reduce older adult falls across the state. If you're interested in learning more about the coalition or getting involved, some information will be shared towards the end of today's webinar for you to be able to do that. We know that falls are common as we age, but we also know that they don't have to be a normal part of aging. There's many opportunities for CBOs and EMS agencies to partner to address this issue. We know, according to the Wisconsin Department of Health Services, in 2022, EMS responded to over 130,000 falls statewide, making it the #1 injury response. And we also know that those numbers are increasing by nearly 10,000 a year statewide. That's why we're really excited to release this toolkit to help address this growing concern. Before we get started, I'm going to launch a quick poll so we can kind of see where people are coming from. So you should see it on your screen now. There are 2 questions. The first, just wondering what sort of organization you represent. And then the second question, depending if you're an EMS agency or a community-based organization, if you currently collaborate with the other. So I'm going to give a little bit of time for those responses to come through. Maybe 5 more seconds here. It's slowing down a little bit. Okay, so hopefully you can see those results here. It looks like a good mix of people on the call today. So many people from ADRCs and public safety, and it looks like a majority, so 64% currently collaborate, which is great. So I just wanted to introduce the toolkit if you haven't seen it yet. The toolkit was developed after a number of listening sessions were held in the summer of 2024, so last year, with EMS providers, and then also with conversations with some community-based organizations throughout Wisconsin. And the goal of the listening sessions that we held was really to learn from our EMS partners, who are the boots on the ground, regularly responding to older adult fall calls, and brainstorming ways that EMS and CBOs can work together to reduce and prevent falls. Numerous strategies were identified for different ways that EMS and CBOs can work together and are outlined in the toolkit. We aren't going to go through all of the strategies here today, so I do encourage you to look at the toolkit in more detail on your own time. It's, very short. We didn't want to make it a 50-page document, but today we'll highlight just a few of the strategies and ways that partners who helped develop the toolkit, both EMS and CBO organizations, have used the toolkit to develop or enhance relationships to prevent falls in their local communities. I also wanted to take a little bit of time to acknowledge that this publication was supported by the Administration for Community Living, and give a lot of thanks to the people and agencies in Wisconsin that provided their time, whether that was through attending a listening session, sharing example policies and programs, or providing feedback during the development of the toolkit. I also wanted to thank Palm Beach County Fire Rescue in Florida and the Saskatoon Fire Department in Canada for agreeing to include their tried and true best practices examples. Collaboration to prevent falls is truly, truly important. So we're really grateful for all of the partnerships with our agencies in Wisconsin and outside of Wisconsin and even the US. So this toolkit outlines tested and untested ideas for local CBO and EMS collaborations to reduce falls among older adults. The toolkit could be used by either a CBO or an EMS agency, with the goal being to engage the other, look through the toolkit to identify what strategies might be feasible to implement, and then work together to implement the chosen strategy or strategies locally. So this collaboration between the two different types of agencies really provides an opportunity to expand falls prevention efforts by utilizing each other to provide information to engage in policy and systems changes, like making home environment safety safer and easier and more accessible, referring individuals to community-based programming or other supports, and working together to support older adults in local communities. We know that EMS is inundated with lift assist calls, with some agencies in Wisconsin reporting 50% or more of their calls are for help related to falls, which utilizes their time and resources and potentially even causes harm to the EMS personnel through repeated lift assist calls. So expanding the falls prevention outreach through a collaborative approach through CBOs and EMS agencies who see firsthand into the homes of people who are falling will help to increase promotion and utilization of falls prevention programming, increase knowledge of the Falls Free Wisconsin website and other resources, and really ultimately aims to reduce older adult falls, their related injuries, and deaths. So the toolkit outlines 6 different strategies, which you can see laid out here on the screen, and includes resources for professionals, including example policies and procedures and consumer take-home materials. At any point throughout the process of looking through this toolkit and identifying strategies or working together with your local agencies, the Falls Free Wisconsin Coalition is available for assistance and guidance. We have a large network of both CBOs and EMS agencies, and would be happy to be able to provide support to the organizations implementing these strategies. We would also love to hear if you have used this toolkit or implemented one of the identified strategies. We have a forum on our website where you can share your implementation story. We also mean this to be a living document. So as we hear stories throughout the state of people that are doing these strategies and learning different things in local communities, we want to add resources to this toolkit or refine as needed. So I'm very briefly going to go to the website where you can find the toolkit, just so you can see it if you haven't already. So where you'll find it is at fffwi.org under the For Professionals, How to Help section. And it's right here. I'm going to make this a little bit bigger. You can see it a little bit easier. But I just very briefly wanted to outline the different strategies, and this is a 15 or so page document, so you can really see how concise it is. So it goes into some of the background information, how to use it, and then each strategy has a page or two that outlines some steps on how to implement the local strategy. So you'll see we have community EMS or mobile integrated health strategy, integration with healthcare system, which we'll talk more about today with Kenosha. And that's again, step-by-step instructions on how to do that and different resources in the appendix that relate to the specific strategy. We have referral to Aging and Disability Resource Center or other agency, using the Medical Reserve Corps or volunteers, community-driven change or a falls prevention coalition strategy, using the iStumble app and lifting cushions, and then some resources here to be able to be used. Next step are references, and then the appendices I wanted to highlight as well. So you'll see here for each of the different strategies, we have some example programs. These are already done and completed by different agencies. You most likely can just plug and play into your different agency depending on what works for you, but sample policies, activation, volunteer job descriptions, different things like that. So it's really meant to be something where you can look at and then plug and play for what works for your community. So with that, I'm going to launch one more poll before we go into our speakers. Just curious on the call today, who of you have currently implemented one of these strategies or currently participate in one of the strategies that are outlined in the toolkit? And if you do participate in some other sort of strategy for reducing older adult falls that isn't listed, I'd love to hear more about what that is in the chat as well. Give maybe about 5 more seconds here. Okay, so it looks like lots of you are participating in referral programs, which is great. Some community EMS, lots of participation in fall prevention coalitions, which is also awesome. Okay, with that, I am really excited to have these falls prevention champions on today to share about their experiences with helping to develop the toolkit and use it locally and what strategies they're working on to prevent falls throughout Wisconsin. You can feel free to drop your questions in the chat throughout, but we do also have some dedicated time toward the end of today's webinar for Q&A with the speakers. I'll turn it over to Carissa and Molly to kick us off and talk about the collaboration between the La Crosse Fire Department and ADRC of La Crosse County and their discussions about using the Medical Reserve Corps volunteers for falls follow-up.
Awesome. Thanks, Suzanne. Really excited to be here with all of you today, talk about this program. I'm a big believer of to borrow and better. So our goal between Chris and I, by the way, I'm Molly, I work at La Crosse Fire. Thanks for having us. Our goal is to give you the house. How did we get this started? How is it currently in operation? And how do we plan to improve it moving forward? And so we're going to go through kind of these 3 steps that you see on your screen. And after we get done chatting, I'll make sure to put my email in the chat so that please feel free to reach out, use us as a resource. We're always excited to help and engage. And if you can't tell already, I like to talk. So with that, I'll shoot it over to my partner in crime here, Carissa, to start us off.
Perfect. Thank you so much. Yep. So my name is Carissa and I manage the ADRC here in La Crosse County. I'm going to talk a little bit about how we got started with some of this. I know we're going to focus on use of volunteers or the Medical Reserve Corps, but certainly that did start with some local conversation about, what is the data in La Crosse County, actively working with our La Crosse County Falls Prevention to determine, what more can we do. So I don't know if you want to advance in the next slide. So as a coalition, myself and, the La Crosse Fire Department and many other professionals within our community were meeting on a monthly basis. And again, the fire department had always been very active in our coalition, coming to the group, providing falls related data with really the sort of increase in falls, but sort of lack of next steps, right? And in some cases expressing that as, the fire department, going to homes on a regular basis, helping people up from a fall, with not much of what comes next, knowing that they'll probably be there, the following day in a few weeks, some of those repeated fallers, right? So as a coalition, certainly working to try to help support our community and figure out, how we can support the work of the fire department in this case in particular. One of our coalition members had learned of a referral program that was occurring in Brown County, specifically with the Brown County Fire Department. So a few of us championed this. So we had an individual from our local healthcare facility and the trauma and injury prevention department, as well as Molly's predecessor, but the community risk educator through the La Crosse Fire Department, and then myself being active members in this coalition, contacting Brown County to learn about their referral program, and really that La Crosse Fire Department championed that to have conversations, learn more about their system, and get a referral system in place here at La Crosse County. In order to then do that, we did have some paperwork that needed to happen. So all of this began in early 2019, and it took about a year to get this in place, right? So the fire department had to really work on their policies and procedures, put some, software in place, and then this partner MOU really was significant in allowing us to talk collaboratively with the fire department, specifically to have that authorization to be able to talk freely with one another, because not only is it important to have that referral, but it was also important to then follow up and provide, next steps upon having that referral of someone who might have fallen and consented. So another piece of this is patient consent too, to refer to the ADRC. So again, ADRCs can only work with folks who had referred, but then also authorizing that transmission of protected health information and making that ADRC referral. So certainly required, again, some local champions to make all that happen, and some time to get that paperwork in place and ensure that we could run a successful referral program.
Awesome. Suzanne, if you don't mind, hopping to the next slide. So, all that hard work, that year-long process of getting that into place, getting all the team on board, getting the paperwork, those SOPs, so standard operating procedures, kind of what it looks like, how it's executed day to day here at the fire department. So obviously, initially, when you rolled this out, there's going to be training involved for our teams that are on the front lines doing this. They needed to have a solid understanding of what their role was, and then also how the process itself was going to work. And so we did a lot of training at the beginning to kind of even just talk about what the role of the ADRC was going to be, understanding the difference between the ADRC and then those managed care organizations, and what could actually be done. And then from there, we've continued. We do constant training with this. We reflect on it. My EMS coordinator here at La Crosse Fire is another champion that we have that really helps us to push this. So he keeps it on the forefront so people don't forget about it, and that we always are asking for feedback, always trying to make it better. But initially, what happens is our crews are on scene. It can be a situation where it's a first fall for somebody, but it just has the telltale signs. If you've been in EMS, you start to recognize somebody that you could potentially get ahead of it, so they don't become a frequent flyer. You can help, mitigate that risk, keep them out of the hospital, keep them living independently. And ultimately, that's our goal. And so it's not just a focus on those frequent flyers, but how can we get ahead of that situation? So crews are on scene. They, have a checklist from that training that they've gone through. What criteria am I looking for? This person's a good candidate for a fall referral. So then they make contact with that patient regarding the program. They say, hey, we'd love to get you connected with other resources. Are you open to it? So they do a really high-level overview to see if the patient is interested. They have them sign that consent form that Carissa mentioned on the last slide. Then they get back to the station. As they're filling out their reports, we use the image trend software. So they're filling that out, and then we have a worksheet dedicated to a fall referral. We also have a general referral. We also have our APS and CPS in there. So our crews are used to filling this out. But in essence, they're going to fill that out. And then a newer addition, as we've learned since 2019 when we were rolling this out, is that can't always rely on technology to do its job. So my firefighters also are going to be sending me an email, and they're going to be either looping in their battalion chief or their immediate supervisor, just so that we're all on the same page with it. I think that's part of the trickiness of the situation, is that communication is going to be really important if we want to see change, if we want to make it better. And so they shoot me that email just to give me a little bit of a heads up. Hey, make sure that you know that it's coming through. Make sure this is kind of what we saw. They give me a little bit more insight than maybe what the report might. They can give me some background knowledge. So then I know to dig a little bit deeper to see kind of the call volume that we're seeing from that patient. But ultimately, beyond the email, I get a daily report from Image Trend that comes in. It's also a handful of other people at the department that get this report, just so that it doesn't solely rest on my shoulders. If I'm out for any reason, somebody else is going to pick it up and make sure that referral continues in this process. So comes into me, I look at the report, I gather all the information that I can, including a phone call or a talk with the folks that responded on scene. And then I reach out to my primary contact at the ADRC. So we have one kind of dedicated person at the ADRC that is my go-to for this conversation. I know a lot of the team over there. Carissa's awesome, but it's nice to have one kind of key person that I'm able to reach out to. So I send an email. It's encrypted, so we're not violating anything with HIPAA. We have that signed release so that we know we're able to share. And I just give Jade, who's my contact, that information. say, hey, this is what we're seeing. This is what sometimes I say, this is what my crews say would be a good support system. And then that conversation starts, and then Jade takes it to the next level with that follow-up. She makes that connection to those community members, offers up resources depending on the need, and they can do a bunch of stuff from there. Without getting too into the weeds with that, because I get excited, I'll call it in a pause there. That's what it looks like on our side on a day-to-day process. And a lot of this is in the toolkit, those SOPs, the consent form, all of that's already made. Please feel free to borrow and better with that. Suzanne, let's go to the next slide. So any good program, you still have to continue to evaluate it. How can we make it better? What are the gaps that we're seeing? And I think, you know, for us, there were things that we could control in those gaps and things that we couldn't, just like any program. So what we decided to focus on was what was a shortfall that we could really try to do something about. And that was the ability to always follow up with patients. You know, when firefighters are on scene and they're in their gear and they're talking to this individual, they can tell us that they want that help. And sometimes they do, and sometimes they're a little more unsure of it than they lead on. And so sometimes it's hard for the ADRC to actually make that connection. So we said, what if we could do something bigger? What if we could take this to the next level? So here in the city of La Crosse, we're a population of about just over 50,000 people. Our fire department goes on a little over 7,000 calls a year. Frame of reference, about 1,000 of those calls, and this is like really high level overview of the data, so don't quote me on anything, but about 1,000 of those calls are going to be fall or lift assist related. So it's a big need for us, but we're not a huge municipality. We're a decent size. What could we do? Because we don't have a community paramedicine program at the moment. It's something that, you know, we aspire to. But what can we do in the meantime? Is there a resource available to us to fill this gap that doesn't have to be a full-on response? And out of this came the conversations to say, hey, we've got this really cool group in our community called the MRC, the Medical Reserve Corps. It is overseen by our public health department. We have a public health educator who's really awesome, who I work with on a lot of different things, who Carissa works with on a lot of different things. And so we reached out to her and we said, hey, Brenda, I know that you're looking for ways to engage your volunteers. So these are a lot of retired medical professionals, whether that's nurses, paramedics, doctors. Not everybody's retired, but that's the bulk of it. And so we connect with them and say, hey, what if your volunteers would pilot this program with us where they would do that next step, that they could follow up with these patients and be that warm handoff and really be proactive, like a community paramedicine would be, where they go and they're doing these additional visits and helping us not only to build that relationship and that trust, because that's scary. That's got to be scary for older adults to say, hey, I need help, without fear of retribution, without fear of losing their independence. So how do we combat that? And so this group, and it's not in operation right now, it's just on paper. We actually came to this idea through this toolkit process. So thanks, Suzanne, because it's going to help us out. We do have some meetings coming up in about a month with this group of individuals to talk through it with them. So we're right now in the process of putting this pilot together. Ultimately, our goal is to have these volunteers make the connections and then be a resource that can get in there as frequently as we can set it up for this program to help prevent falls in the future. I'm going to pause there just because I know that I am supposed to hand it back, so I don't want to go over time. But like I said, I will put information in the chat. We do a ton of other programs at La Crosse Fire. We just got done with our Mugs for Rugs program, which is super fun. Happy to talk about anything falls prevention related. So Suzanne, I'll give it back to you.
Well, I do want to quickly just say that with this program too, the ADRC would still remain very much a part of it. It'd be a matter of leaning on those MRC volunteers to support the work of an ADRC. So we may or may not have made contact. And if not, maybe an MRC volunteer could go in and build that rapport to then in turn refer to the ADRC. And our ADRCs in nature are generally short-term in service that we provide. And so having more of that ongoing follow-up after we've made connection with the ADRC, perhaps established referrals to different programs and services, but then having an MRC continue to follow along and provide that ongoing support. So again, with the ultimate goal to, reduce falls and keep individuals safe. With that, I think turn it back over to Suzanne. Thank you.
Awesome. Thank you both, Krista and Molly. We're super excited that you guys kind of took this idea and are running with it, and really excited to see how it plays out in La Crosse County over the coming months. But thank you both for all the great work that you are doing. I'm going to pass it over now to Alyssa, who will be talking about using the toolkit to have a conversation with EMS in her community. So Alyssa, I'll let you introduce yourself and share a little bit more about that.
Great. Thank you, Suzanne. Well, I'm Alyssa Lammers. As Suzanne said, I'm with the ADRC of Barron and Rusk counties. I kind of have a dual role here. I am the caregiver specialist for Barron County, but I also am the health promotions coordinator for both Barron and Rusk counties. And part of my work over the next couple of years, or part of my goal over the next couple of years, through our aging plan is to kind of twofold. Number one, to expand our Stepping On program, and number two, to develop falls coalitions in our communities. I'm kind of starting from square one here. I'm where Molly and Carissa were in 2019. I kind of came on during the pandemic, and prior to that, there was some work starting to happen around falls prevention and a referral program to the ADRC, but then the pandemic happened and it sort of all fell apart. And so my goal over the next couple of years is really to start at square one and build coalitions in both of our counties related to falls, and hopefully develop a referral system to the ADRC for both counties. So this toolkit was perfect timing for me on two different levels. Number one, the coalition work, how to start the coalitions. I'm on other coalitions, but starting from scratch and building those in each of our counties. And then to also start the conversation about a referral program in each of our counties. So as of January 1, I started a coalition in Rusk County, which, if you are from the Northwest Wisconsin area, we are very rural up here, which poses, some unique challenges to working with community partners and the community in general, and just getting the word out about our work. So I wanted to start the focus in Rusk County because they are even more rural than Barron County, and we just tend to have more resources in Barron County. So as of January 1, I launched the Falls Coalition in Rusk County, working with a lot of different partners, including EMS, the EMS provider, and our emergency management director over there, the healthcare systems, long-term care, public health, volunteers from the community, down to the library, and a whole slew of other people. We have about, I think, 30 partners that are actively engaging in that coalition right now. But we've only had a few meetings because we launched it at the beginning of January, and I've used that toolkit to start our work and start the initial conversations with the EMS provider around a potential referral system. Like I said, there are some unique challenges to implementing this. For instance, the EMS provider in Rusk County, they do not have any kind of electronic devices on their rigs. So we're looking at, starting from square one, and is it a paper referral? What is that going to look like? And how not to make it a lot of work for the boots on the ground people who are actually going into the home and eventually making that referral. So like I said, it's very initial stages, but this toolkit really, gave me the tools to be able to begin that conversation and say, hey, where can we start and where can we go from here? The nice thing is I have really engaged partners, which sometimes is half the battle, finding those people who really want to do the work and want to improve the resources available for falls prevention. So it's in its early stages, but I found the toolkit really helpful, specifically the policies and procedures from other agencies like La Crosse County. They're already doing it. We don't have to recreate the wheel, and we can just kind of take what they're already doing and adapt it to what we need. So I'm looking forward to the work over the next year, 2 years. My goal is to launch a Falls Coalition in 2026 in Barron County and just continue that work. So I'm hopeful that we'll have a referral system in place, hopefully by the end of 2025, maybe early 2026 in Rusk County, and then hopefully duplicate that in Barron County in 2026. So yeah, that's kind of where I'm at.
Awesome. Thank you, Alyssa, for sharing what's going on in Northwest Wisconsin. I know there's about 10 local falls prevention coalitions in Wisconsin, with Rusk County being the newest. So really exciting to see that those conversations are happening, and we're going to be excited to see what comes out of that in the coming years, like you said. And I'm just gonna, kind of go back to what Molly said about borrowing and bettering things. We don't have to recreate the wheel with any of this. There's so many resources that are already currently out there to do exactly that: borrow and better and implement in other communities. So thank you, Alyssa. Yeah, I'm gonna move now to southeastern Wisconsin and pass it over to Jim and Dr. Karajas, who are with Kenosha. And they're here to talk about discussions in Kenosha related to integration with healthcare post-lift assist. So Jim, I think I'm going to pass it over to you first.
Sure, thank you. Good morning, everyone. My name is Jim Poltrock. As Suzanne said, I work with Aurora Kenosha. I'm a part-time project coordinator there, working on a project that you see on the screen called Connecting the Dots, building a fall intervention team in Kenosha County. By way of background, next slide, please, Suzanne. I spent the majority of my professional career on the Kenosha Fire Department. I started as a firefighter, paramedic, and for the last 12 years of my career there, I was the EMS chief. During that time, I became acutely aware that the number of fall calls was continuing to rise year by year, and started seeking out some alternatives versus the wash, rinse, repeat, respond mode that we were in for some of the repeat fallers. Is how can we connect dots and get some additional assistance to some of the people that we were seeing, elderly people who were falling. After I retired, which was 4 years ago, I did some work with Kenosha County Public Health. During COVID, I was doing home visits for the elderly and disabled who wanted to be vaccinated, and I did almost 1,000 home visits in Kenosha County, which afforded me the opportunity to actually sit down and have a conversation with some of these people to find out what their challenges were, and just listen to them and see where they were at with the aging process and some of the challenges that they were having. Generally, and that was the most rewarding work that I've ever done in my professional career. So I really enjoyed that. I had an opportunity came up at Aurora Hospital in Kenosha where I became the EMS coordinator, and I stepped away from that to launch this project. Next slide, please, Suzanne. I came to know of a funding opportunity through the Advancing Healthier Wisconsin endowment at the Medical College of Wisconsin. They had community seed grants, and one of them seemed to match up perfectly with putting a fall referral place in, putting a fall referral mechanism in place for all the fire departments in Kenosha. I set something up very similar to what Molly was talking about in La Crosse when I was on the Kenosha Fire Department. That was about 7 years ago, where we started doing referrals to the ADRC, and I started getting to know the people over there, breaking down organizational silos. How can we have the power of the hive to work together on these things? But the city of Kenosha is not the only fire department in the county. So I pursued this funding opportunity, and it was awarded to actually build out a referral process and make this more robust for all the fire departments in Kenosha County. And that's the project that I've been working on since almost a year ago. It ends at the end of June of this year. But for anybody out there who's listening, take a look at this funding opportunity. It may match up with some of the initiatives and programs and projects that you're working on in your county and be of great assistance. And we're very, very fortunate to have acquired that grant. I'm just going to go through the aims of the grant, of the project that we're working on. As you can see there, number one was to establish those new partnerships and break down the organizational silos. First of all, we had to understand that we were in a silo and we don't have to approach this challenge of increased number of elder fall related calls alone, that there were other services in Kenosha County, chiefly the Aging Disability Resource Center through the county. And we could start working together, build relationships. Of course, I reached out. We were fortunate enough that the woman who was leading the ADRC in Kenosha County, Laverne, was also on the board of directors at WEHA. So I was able to make a connection there. And they came on board as a community partner for this project as well. And they've been of great assistance. So we're all the fire departments in the county. Reach out to the medical examiner's office, dispatch, a valuable source of data on how many calls, fall-related calls, and they can break it down and do demographic analysis throughout the county. And of course, the hospital systems in Kenosha County. We came down and we hosted a listening session last year that Suzanne referenced a little bit earlier, and it actually brought together a whole room full, 25 or 30 of these stakeholders all in the room at the same time. So we were able to have a really good conversation on how we can further move this project forward and who the champions were at each individual organization that could lead the charge. Molly is spot on. You got to find who the champions are in the organization, who's passionate about this subject, who's motivated, who really, really wants to help and do something about it, other than just recognize that it is a challenge and it's going to become more of a challenge as the population ages. So find those champions in your organization. The referral process has been challenging to get some of the fire departments on, and some of the challenges that I've seen are it takes time for those data sharing agreements, which are included in the tool. It has to go through corporation counsel. Each individual municipality's lawyer has to review it and work it out, and that takes a lot of time to get that going. So something for you to consider if you move forward. Each fire department has different technological challenges that they have to face. All of them are using ImageTrend, but not. Some of them are just not as fluent as some of the larger departments are, and changing and customizing the electronic patient care record to include a fall referral process. So that's something to keep in mind as well. Staffing at some of the faller departments, some of the volunteer departments just don't have enough people, horsepower to put something like this in place in a really timely fashion. It just takes a little bit of time and something to be mindful of. And of course, the training aspect of it, getting out to the departments and explaining to all the EMS providers what the referral process is all about, how it works, what the mechanism is at the ADRC, what they do about it. So they have that aha moment that, you know what, we're not just filling out a referral that's going to be a data point that goes off into the ether. There's actually somebody at the ADRC, and we're very fortunate in Kenosha County to have a full-time fall coordinator who receives these referrals and then begins the follow-up mechanism, which can include a home visit. Something new that came out of our relationship building and collaboration with the medical examiner's office is that we're going to be putting together a fall death review team, very similar to the overdose review team. The thought being this, well, we get together monthly, every other month to do overdose review for individuals who are substance abuse related overdoses in our community. Why don't we do something for fall death review as well? There could be some opportunities that we can glean from doing a review of that nature, very similar to what we're doing for overdose, and build relationships in the process. And that's going to be taking off at the end of this month, spearheaded by the medical examiner's office and our ADRC. Number three, contact your fall patients if you haven't already. I had the opportunity to be in hundreds and hundreds of homes and speak with them directly. And in my work at the emergency department, when the patients would come in, I would go in and just speak with them and find out what their challenges were. And it's important to listen to the voice of the customer. I hate to use that term customer, the voice of the patient, to find out what their medical needs are and their challenges and how we can help them so we can go about connecting the proper dots and getting them that assistance. And then the fourth project aim, Suzanne, was data collection, the QI system. We're in the process of doing that. It's how many referrals are coming in, how many follow-ups are being done. And that's ongoing, but it's important to establish that CQI process of plan, do, check, act, and continue to build the system and improve upon it. Having so many stakeholders involved, it is challenging, but the juice is worth the squeeze. So have to do it to improve the system. And I talked about a little bit earlier, engaging both hospital systems who provide medical direction to the EMS services in our county, and during their continuing education and training, getting out in front of them, bringing the ADRC staff to explain what they're doing behind the scenes, and focusing on the geriatric patient assessment and injury treatment on an ongoing basis, and why it's important to be a good medical clinician with a lot of these calls versus the danger of anchoring on, oh, we picked up Ethel 2 times this week, and now we're called for another lift assist, and we help her up and put her in a chair. It's always be a good clinician and do a thorough assessment, because those patients sometimes are quite ill and have something else going on. So we're doing a lot of education and training. Most of that is wrapping up just this month with Freighter South, and Aurora has already completed that with their providers as well. So that's the essence of the project. It was, like I said, the $50,000 community seed grant through the Advancing Healthier Wisconsin Foundation that allowed us to expand out what the city of Kenosha was doing for the rest of the departments and bringing together other stakeholders in the county. Happy to, if anybody has any questions, if you want to put it in the chat, happy to field that. Otherwise, I'll pass it over to my comrade, Dr. Tom Karajas.
Thank you, Jim. So good morning, everyone. I'm Tom Karajas. I'm an emergency medicine physician. I've been at Aurora Medical Center, Kenosha, for about 11 years in the role of the emergency department medical director. I've had the pleasure of working with Jim over the past couple of years. Jim has been an amazing resource with his connectivity within the county of Kenosha, as well as with EMS. So we have worked together, and as Jim alluded to a meeting a few months ago with all the stakeholders in the county, myself and our physician partners at Freighter South across the street were able to sit down with all the stakeholders, and especially Kenosha Fire and other community EMS departments, and talk about the falls issue. And we heard firsthand about a lot of the frustrations about the patients who are frequently falling. EMS is going to the home, picking up Ethel, putting her back in the chair, and then really having no follow-up. So the question was put to us as to how can we help? What can we do? So that got the ball rolling. And what we're trying to do is really mirror what we do in the hospital, but on an outpatient basis. So let's go to the next slide. So really it's trying to get some patient follow-up after a refusal of transport, which is, obviously a big problem throughout the state. And the purpose here is really to identify those patients at risk for recurrent falls and to prevent future injury. And of course, we need patient consent, but EMS to transmit patient information to an Aurora email box, at least from my side. Let's go next slide. So this has taken a lot of groundwork to get to this step. The question was, well, if EMS is able to send patient information currently to the ADRC, they should be able to do something similar to the two hospital systems in town. We are separate, so we have Aurora and we have the Frederick Health System. And both of our health systems can set up something similar where once the patient has consented to transmission of information to their primary care, then we have a generic email box that patient information can be sent to securely. And then I've already partnered with our emergency department social workers. So we have social work coverage Monday through Friday from 8 a.m. to 11 p.m. every day, daytime hours on the weekends. And our social workers are willing to monitor this inbox for patient information and then be able to confirm the patient's primary care. And through our charting system, our Epic software, be able to message the patient's primary care that one of their patients in the community had a fall or had an EMS call and refused transport for the sole purpose of notifying them so that they can reach out to the patient and arrange for either a follow-up visit in the office or a home health referral. Let's go to the next slide. So what someone just put in the chat, yes, patients do not want to go to the emergency department. They don't like our environment, which I fully understand. They come in, they wait, it takes hours. Patients are afraid about what might happen going forward that will keep them in the hospital against their will. They'll lose some of their identity or their independence. So what we do right now, when a patient is transported after a fall, let's say they're evaluated, there's no significant injury. What can we do to help prevent that on the hospital-based side? So we have them seen by social work in the emergency department. We have physical therapy available, daytime hours to be able to do an evaluation. We work with the patient for mobility, safety with ambulating. We can teach them to use assist devices, a walker, a cane. We talk about falls prevention. We can get them home resources. So we want to do this same process for these patients that refuse transport. So if they don't want to come in and see their primary care or they have problems with transportation, then a home health referral can be entered, and that can encompass both nursing and physical and occupational therapy. So they will actually do a home visit. They'll do a home safety evaluation. They will evaluate their medications for polypharmacy, which is a big cause for falls and other morbidity in that population. Physical therapy will visit them at the house and do an evaluation and can schedule weekly home PT or OT in their home in order to prevent falls in the future. So this is the process that we wanted to mirror. And we are hoping that we can fully launch this right now. The consent piece is stuck with our risk management department. Hopefully with their approval, we can then take the next step. So this has been a long process. We're very close to reaching the end, and hopefully we won't have any more difficulty with this. I think that's the last slide.
Awesome. Thank you so much, Dr. Karajas and Jim, for sharing kind of the conversations and all the great things that are happening in Kenosha County. So we do have some time for questions now, and I did see lots of great questions in the chat. Some have been answered, but let me just get there, and feel free to continue to drop your questions in the chat. First question I see is, sometimes EMS is part of the fire department, sometimes they're not. How is Wisconsin organized? And are EMS providers separate as they typically are in Connecticut? So I will kind of pass it over to our EMS partners on the call maybe to answer that question. So it looks like we have some partners in Connecticut that are interested in learning a little bit about what's happening in Wisconsin. So I don't know, Molly or Jim, if you'd be able to speak to that one.
Yeah, and Jim might know more statewide than I do. I'll set locally at La Crosse Fire, we're a non-transport agency. We do EMS, we respond. My department is a full-time career department. So my crews are here for a 48-hour shift. But they're all EMT level certified, and then some of them are paramedics. And then we partner, we have one of our local hospitals runs our nonprofit transport agency, which is Tri-State Ambulance. So that's how we do it locally, but I know several fire departments that are transport agencies in the state. So they do EMS and have their own ambulances as well. Jim, I'll have you weigh in if you have anything better to say.
Yeah, it's kind of a mix match, isn't it? Throughout the state, everyone's doing their own thing. In Kenosha County, all of the services here are a combination fire and EMS, so they are doing transport. But Milwaukee, much larger service, all their basic calls are handled by private ambulance services, and then the fire department itself does ALS. So it kind of depends on where you end up going.
Awesome, thank you both. Another question in the chat, wondering if the Wisconsin fire departments have been active with the Steps to Safety program. Is there collaboration, interest, or no interest? So again, Molly and Jim, feel free to weigh in if you know of any fire departments that are doing Steps to Safety, but Steps to Safety is mentioned in the toolkit. That was one of the great examples that we got for using volunteers from Canada, actually. So we have their great application, volunteer application forms. They have a really robust program there.
And yeah, we advertise the program, but we don't teach it here in La Crosse because we have partners that do a great job with it. So I'm often a guest speaker, but again, one of our local hospital healthcare systems offers that program. And then I know that Carissa and her team do a good job of advertising it as well. So it's here, we try to push it out, but the fire department doesn't own that here.
Thanks, Molly. There's some empathy on, Alyssa, I believe is your story about the start and stop of coalitions around the pandemic. Same experience happening in Connecticut, and I'm assuming that's not unique as well. There are also questions about the medical reserve corps. So it looks like some of that has been answered in the chat, but there's a link in the toolkit for finding out more about the medical reserve corps and where those are throughout Wisconsin, and information on how to start one of those as well. Like there is one in Juneau County, so that's great. Let's see here. Okay, looks like all of the questions in the chat have been answered so far. So I'll give a little bit more time. If anyone wants to come off mute and ask a question, feel free to do that as well. I'd love to pose a question just in the meantime while we wait, since we do have a couple of minutes here, but if anyone would be willing to share either in the chat or coming off mute on what other ways do you work with your CBOs or EMS agencies to prevent falls? So feel free to share on that as well. I know, Molly, you were talking about mugs for rugs briefly. If you want to maybe give a brief 1-minute overview. I know I'm putting you on the spot about that program.
No, I'm just impressed that you guys want me to talk more. I would love to talk. Yeah, Mugs for Rugs, again, a borrow and better situation. It's a program that came out of Colorado, and then I believe it was either Oshkosh Fire or I think Oshkosh Fire did it. So we contacted them, and we partnered with Amplify by Gunderson, which is one of our healthcare systems over here on the side of the state. And so in the month of March, we have 9 coffee shops that agree to accept rugs from older adults to get that tripping hazard out, but it's really about education. So here I have one of the mugs, hold tight. So they look like this, and then it's got a QR code, takes you to our website with all kinds of tools and resources, including the Stepping On program and Steps to Safety, all that good stuff is all related in that. And then this year we added that all of the collected rugs are going to be repurposed into cat scratching posts by local high school students and donated as a fundraiser for our Humane Society. So lots of cool stuff happening, always exciting to talk about it. So happy to share if you want more.
Awesome. Thanks, Molly. We do have a link on the Falls Through Wisconsin website with that links to, I think, La Crosse's program, and then also It's been done in a couple of different areas in Wisconsin too. So if you're interested in learning more, definitely check that out. Well, I'm not seeing any more questions in the chat, but I do want to encourage everyone to visit our Falls Free Wisconsin website where you'll find the toolkit. Take a look around. We have lots of other great information on there as well. And if you're interested in getting involved and joining the Falls Free Wisconsin Coalition, we'd love to have you too. Thank you again to everyone that helped in the development of the toolkit. Thank you to those that presented on today's webinar. I think it'll be great to see all of the amazing things that are coming out of different areas in Wisconsin. Again, some of these are currently in the works. So within the next year or so, we'll have some more best practices and lessons learned to share for sure.
Suzanne?
So, yeah, go ahead, Susan.
Hi, thanks. I'm sorry. I had to log in on a different computer in order to get access. I'm wondering in the couple of minutes that we have, if we can't talk a little bit about coordinating, collaborating, because what I'm hearing from Jim and Thomas and you and so many others is what we're seeing here in the state of Connecticut is that there's so many individual pieces that are doing a part of the problem, addressing a part of the problem. So how can we, I mean, even, you know, you have differences in Wisconsin between all your different counties. Here in Connecticut, we're just now sort of organizing in county equivalent. I guess we have regional councils of government, but they're primarily land management. We just have all of these different pieces. We have hospitals, we have emergency department, we have urgent care centers, we have aging facilities, we have nursing home care or assisted living. We have just like all kinds of pockets of people that are addressing pieces of falls or response and prevention. And with the, I guess with the steps to safety, it's, you know, we talked about how do we get all of these people to start talking with each other so that we can sort of capitalize on the resources that we all have. And I wonder if people can speak a little bit to that, because that's what I see as our struggle.
Mm-hmm. Yeah, I'll maybe start, and I know we don't have much time left, but if anyone else wants to jump in, I think we're really lucky in Wisconsin to have, you know, we have the statewide Falls Free Wisconsin Coalition, which provides coordination and collaboration, but then we also have many, like I said, about 10 local falls prevention coalitions. Like Alyssa was sharing about their new coalition, and there's the Kenosha Coalition, there's the Cross Falls Coalition. So getting all of those partners at the table to even start those conversations, I think is super important. And I know champions are mentioned a couple of times too, so I think that piece of it is extremely important too, but I'll let anyone else jump in too.
Yeah, I agree. On the local level, find out who your power players are, who are more interested in having a bias towards action and doing something, you know, putting rubber on the road versus people who want to have 11,000 meetings. You know, what can we do in the short term, who your power players are, and then just build out from that, build relationships.
Yeah, I kind of look at it like when you're throwing a party. It's a little nerve-wracking to throw a party because you don't know who's going to show up, but you don't know unless you throw the party. So set up a meeting and get some people involved, and more people will join. Like the coolest thing about all the coalition work that I get to do is that even though it starts small, when people see you doing things, just like Jim was saying, when they see action happening, you're going to attract a lot more people to the table.
Yeah, thanks everyone. In Wisconsin too, I don't know how it is in Connecticut. We also have regional trauma advisory councils that are really active players too. So again, I'm not sure if that's a thing in Connecticut, but we have a state trauma advisory council and then regional ones in Wisconsin too. All right, well, thank you so much. So just with a minute left, again, I know there's contact information shared in the chat for many of our speakers. And again, the contact information to contact me is on the screen. Happy to help with any technical assistance questions or connecting with local partners. And a recording of this webinar is going to be sent out by the end of this week. And then everyone who registered will receive a copy of the recording and future communication from Falls Free Wisconsin. And then after you close out of this webinar, you'll be automatically redirected to an evaluation right in your internet browser. So we really appreciate your feedback. Thanks, everyone. Have a great rest of your week.